Welcome to Integrated Health of Indiana's Talk at 10, and today we're going to talk about SIBO and gut dysbiosis. And we're actually going to start out by defining these terms because, I didn't know until some time ago what this actually was. And upon doing a lot of testing with patients, and the testing that we actually do is called the Biome FX. This is the PCR portion of the genome, or you're testing the genome to see what's in there. And it's how they also work with doing the testing for COVID and stuff like that. So they have the diagnosis, or they know what it looks like because of its genetic marker. And I actually forgot to say morning. And so she's hiding behind me because she's cold and we have guests in the room. So let's start out by discussing gut dysbiosis, because SIBO falls under the umbrella of gut dysbiosis. So if you have SIBO, that is a form of gut dysbiosis. And SIBO is actually defined as small intestinal bacterial overgrowth. So when you start to do a test, this is actually, I thought I had mine in here. Can you go back to the back and grab mine? Because I don't want to use yours on line. So when we look at something called alpha diversity and beta diversity, alpha diversity is the population of the bacterial species. So all the different ones, and you want to have a wide variety, a very diverse population. And then beta diversity is looking at all of the different species, and then what's the number? What's the richness of the number of the population? And those are the things that, as we have started to see, because the gut biome, the microbiome, is really a relatively new and emerging field, but it connects to everything. Your gut, if you think about your gut is a tube that starts at the mouth, ends at the anus. Let's go back. Thank you. So when we look at this, we start to see, when we look at the gut microbiome index, and then we look at, there was the alpha diversity and beta diversity that I talk about. And then we look at the richness of all of the species. And this is your resistome. So that resistome is your ability to resist disease, COVID-19, or let's say one of the bacteria in your gut is a pneumococcus bacteria. Your ability to resist getting pneumonia is in the richness of having everybody else. So this is kind of that idea of the population checks itself. So if you remember back to World War I, and well, we're not going to remember back to it, but the ads for, if you see something that is out of line, report it. And that self-reporting, where the population is helping the police do the policing of the population. It's the same way with our gut microbiome. And so back to the donut analogy. So basically, your gut, or this thing that is the entire gut, is separated from the rest of the body. So when you eat something, what you eat is separate from the bloodstream, and your body depends on that protection. So if you eat something that you're allergic to, your body depends on the secretory IgA in the stomach to not allow this to pass. and it wants to take it, it wants to get a hold of it, and it wants to transport it out. You will probably still get symptoms. This is called an IgG response. This is why, if you're working with a doctor that does this type of work or does a food sensitivity work, food sensitivities are IgG moderated sensitivities, meaning that you don't have an allergic reaction. I need an EpiPen. We're starting to swell the throat and this, that, and the other. This is the if I drink a beer and the wheat, the gluten from the beer will start to give me a rash. That's an IgG moderated response. And so I depend on secretory IgA and that stuff to protect me. And when you look at my thing, the reason why I'm becoming sensitive is both my species richness, my beta diversity is good, but my alpha diversity is not. And so I don't have the species of bacteria in my gut to protect me from the wheat, the gluten, the allergens, and stuff like that. Although I'm, the funny thing is all in all, I'm pretty relatively healthy. A1C of a 5.1, blood sugars run in that fasting 75 to 85. During the day, they run at about 90. If you go look up 5.1, you can get an average daily glucose out of that. But blood pressure's good, pulse rate's good. My my aura ring tells me if my heart rate variability is off. So there are all these indicators on my dashboard that everything is good. I don't want good, I want great. So I'm digging in deeper and I'm seeing that, well, hey, I do get a rash. Hey, I do have some issues with sensitivities. How do I fix that? So that if I do get into something, then that's not going to take me down. Part of the problem with COVID at this point in time is people do not have that resiliency. And this starts in the gut. So the donut analogy is you're stacking those donuts on top of each other all the way down, and what's in the hole stays in the hole, and what's outside the hole stays outside the hole. You have you have one cell thick membrane, there you go, that separates the what's in the gut from the bloodstream. And so if you have dysbiosis, you start to actually have problems with these things, and you can start to get what is called a leaky gut. And so we start to see problems with allergies, autoimmune issues. I mean, it can cause everything because there's a great book called The Second Brain. There's also another book called The Gut Brain Connection, and they go through the science of how these things are related. And basically, your vagal nerve and the enteropathic nervous system has more connections to the brain than your body does via the spinal nerves. So, as we're going along, um, I've defined what gut dysbiosis is. SIBO is a portion of gut dysbiosis. The gut is basically a donut. The gut is a sealed unit all the way through from mouth to anus, and it's not supposed to allow things to get in. So when you start to have these problems in this, then things start to get through. You can have problems with LPS, lipopolysaccharides, and that type of stuff. And that's why we want the richness. So how do you, any questions yet? We have guests, and so I've been going along.
How can a spinal subluxation relate to gut dysbiosis or SIBO? Is there any correlation between the two?
So the way the subluxation would integrate with that would be through the parasympathetic sympathetic nervous system. We are not going to directly affect the actual bacteria, but what we will affect is the transport of information from the brain or the hypoglossal nerve to the gut, allowing motility, allowing that stuff to move faster and freer. So if you're having motility issues, you're getting constipated, you're getting stuff like that. If we stimulate that area in the back, that pelvic splanchnic nerves and those things, if we stimulate those, then we can start to move things through faster. And then you're just layering in health when you layer in bitters and you layer in digestive aids and you layer in fiber and you layer in all these things that the bacteria then want. You're helping the people that want you to do better. And so it's just a synergistic relationship at that point in time. Plus, the adjustment releases endorphins, which causes the body to relax, takes your parasympathetic, helps the digestive system. So those are all wonderful things and how that kind of interrelates. So it's like I said, a synergistic relationship. And so to affect SIBO and things like that, if you are always excited and always in an anxious state, you're going to cause cortisol to raise, which will cause blood sugar to raise, which will raise insulin. And there you have a fire going on. And then your stronger bacteria that are more resilient to everything else. I mean, think about C. diff. C. diff is in your gut. And it's only when C. diff gets out of balance that it causes a problem. Well, how can we cause that problem? How can we cause a SIBO reaction or a dysbiosis reaction? Taking antibiotics. Where does most of the C. diff that we hear about happen? In a hospital. You hear about C. diff breakouts in the hospital. And this is because nursing homes too. Yep. And this happens because we have to really start to get a very sterile environment, especially in a hospital. And how do we create sterile environments?
Well, that's not how it's created in the hospital. C. diff is a spore that we can't kill. And we can't kill it with the bleach and all that. So you carry it. It's actually carried.
Clostridium difficile, and it's hard to kill.
Yeah, you can't live in. You can't kill it. They try to use bleach, but
doesn't work.
It's got like a capsule around it, so
that's the biofilm.
Gets the perfect environment and it grows. But we carry that all over the place. You have to wash it off.
But it's also inside the gut.
It is in the gut. But once it gets out of the gut, it's everywhere.
Yeah, and so once again, you cannot kill it. You have to bring in everybody else to help control it. And so that's what has to happen. In a hospital, we just don't have that ability. Now, actually, Bayer is looking for...
Let's try to kill it, but...
Doesn't work.
Well, I mean, we hope it does. That's our last resort. But really, you have to rely on washing your hands. It's hygiene is typically how it's controlled.
And so you're looking at, well, back to my thought, Bayer, which owns Monsanto, is now looking at trying to get a patent to use glyphosate,
more chemicals
in the hospital, because it's the most potent antibiotic we know. It kills everything. So yeah,
you need a weed killer.
But that, I mean, in every respect, we all try to do our best. Doctors and hospitals are there to save lives, especially in acute traumatic conditions. And in that, they might cause a bit of a mess in trying to save somebody's life. It's the old analogy that you're going to get a little worse before you get better. Well, you can't have a raging infection and all this stuff going on when you're trying to heal up with, say, you had a car accident or say something like that. But this is also why, and I'm going to plead, remember, I'm a chiropractor, acupuncturist, and this, that, and the other. I'm not a medical doctor. I do not have a license to prescribe. But even the doctors now that are very well informed that are teaching me in the IFM and stuff like that all say the same thing. If you have a cold, let it run its course. That's how your immune system learns. If you have a fever that's not over 100 and...
We don't really worry about them unless they're over 101.5.
So if you have a fever, that's how the body learns. If you dose every sniffle, every whatever with antibiotics, you are just
taking out the mechanisms that teach your body to heal itself.
Taking out the mechanism to teach the body to heal itself. And then we as the consumer are causing resistant bacteria. But we don't want to go to the doctor and have a doctor tell us, hey, go home, let it run its course, you're going to live. We want
value for $1.
Yeah.
I want the script.
I want a script. I don't want to feel pain. Suck it up. I mean, I've had fevers and I'm 50. I come from the age where my mom looked at me, put the hand on the head. Oh, you got a fever. Here comes the cold, wet towel. And that was it. I never went to the hospital. And I think I had a 102. I can remember like a 102 a couple of times. I lived. I'm okay. You know, it's definitely people start to have seizures, get them in there. If they're running 103 for a long time, get them in there. How long would you say?
We don't let them run fevers that high very long.
So
we start cooling
an hour?
No, I mean, we'll watch them 2 or 3 hours, but we usually give a Tylenol.
Okay. Well, we're not saying
Bring it
take
down.
Tylenol. I can't say that. But with that all being said, and how this all goes back to SIBO and gut dysbiosis, think about this. If your gut is off and you have ultimately what gut dysbiosis leads to, which is the problem, is leaky gut syndrome. So or in the medical realm, intestinal hyperpermeability. They can't call it leaky gut because chiropractors, naturopaths, and all of us that are over here have been calling it leaky gut for decades and decades. And now intestinal hyperpermeability is starting to show up in the literature. And that's the way that I guess they save face. Not the medical doctors I talk to, because they're all pretty cool about it. But those people that are in the upper echelon that can't be wrong, that's how they save face. Anyway, so if you start to get these things going on,
Tell them what SIBO, tell them what SIBO symptoms are to just a common person.
Okay, SIBO, bloating right off the bat. If you eat something and your stomach just swells up
immediately within 30 minutes of eating.
Yeah, or you feel pregnant, food baby, even reflux. What else? Reflux, instant headache. Oh goodness, the list goes on and on and on. Get the sniffles.
Constipation, diarrhea.
Yeah.
Burning.
Yep, burning in the gut, heavy
Nausea.
feeling. The symptoms are vast, but then typically will pass within, as long as you don't throw more in on it.
But most of it is just that big belly.
Yeah, the big belly and the gas, belching, burping.
But tell them why that happens.
A lot of that is
bacteria feeding on
the fiber. So you got to be careful here, because a little bit of gas, a little bit of belching, a little bit of farting, as long as it's not super, like if you smell the sulfur in the eggs, that's a dysbiosis. Your sulfur bearing bacteria are overpopulated. I mean, that's granted. You ate a salad and you have foul gas afterwards and you have diarrhea, dysbiosis. If you eat a bunch of sauerkraut and eggs and you have it, probably because of the sulfur in the eggs and the kraut. So you got to kind of know and take it hand in hand. But if everything that you do and you eat gives you gut issues and gas, and it's foul and it's smelly and it's this, that, and the other, that's probably SIBO. And yeah, can't lose weight. You're resistant to losing weight no matter what you do. If you allergies, autoimmune diseases, LPS is a huge player in autoimmune disease. LPS is lipopolysaccharides. So when you have SIBO, small intestinal bacterial overgrowth, motility, transport, what they call secretory IgA in the stomach, that is not doing its job. It can't do its job. If you lack a species in the gut called Acromancium Mucinophilia, which I'll show you here. The name's pretty cool to see. Mine's low. See that guy in the middle on the top? Acromancia. So he's low in me. What he does is he's a butyrate producer. Butyrate, you get butyrate from butter and from things like that that help give you butyric acid, and that helps coat the gut. But what mucinophilia does is he actually comes in, and the part of the mucus layer that's damaged, he comes in and he cleans it out. And then you can have the other short chain fatty acid producers, butyrate producers. They come in and they lay a new slime layer down so that your gut is whole and it's healed. But like if you're like me and you have low, then things, if I get into something that I am allergic to, it takes me longer to heal from it. So that's that layering of health. If I have a problem in this layer, I can go through here and here, but takes longer to jump over to here. And that's the same thing with this. You've got to start to set the environment up, because I can't take a probiotic that has Acromancia in it. They're trying to isolate him and bring him in, but they haven't been able to do it yet. So you have to set the garden up. And I say that I'm showing you the gut. You have to set the garden up so that he wants to be there, and then he somehow shows up. I guess it's kind of like if you ever leave water out on the table, or have you ever left your coffee filter out for several days, and unless you have very clean coffee, when you come back and you open it up, what's in the coffee filter? Mold. Where'd that come from? It just comes from the air. And so
most likely the coffee.
Most likely the coffee. But as I have low, I can start to set things up to bring more about, have it populate. He likes fiber. Actually, all these bacteria like fiber. So if you've watched my other videos, you know I'm a huge proponent of the keto diet. What lever does the keto diet pull? What does it do for us?
Resets insulin.
Number one.
Decreases sugar.
Number two, helps with hormones. Does help with a little bit of butyrate. Helps settle cholesterol issues. If you have a good keto diet, you can do dirty keto and be eating bacon and processed meats, and
There's nothing wrong with bacon. There's never ever anything wrong with bacon.
Gotta be good bacon, no nitrates, no nitrites. But if you're eating what they call lazy keto, dirty keto, or whatever else, then your blood lipids will get off. It just happens. But if you are eating a good ketogenic diet and you're bringing the fiber in, keto is known to cause gut dysbiosis. And keto will cause the gut dysbiosis in, where'd it go? I'm going to cheat. I forget the name of the bacteria. Because it's a toluene, and it's caused by the proteins, the heavy proteins. I lost him.
Weeds out some of the good ones because they need carbs.
Well, it causes firmicutes to go up. And so the firmicutes gets to go a a little crazy because you're feeding him and just him. So if you start out having wonky blood sugars like I had, first thing you got to do, the first order is you have to control insulin. Because if you don't control insulin, you're always going to be inflamed. And when you eat fiber, you're going to feed the bad guys. But after you get that balance, and this is when you have a difficult case. You know, if you're 20 years old and you're trucking along and you don't have much going on and you get a little bit out of balance, it's easy to bring that back. You're resilient to it. If you're 50 and you have a history,
50.
yeah, and you have a history of, you know, I used to drink 2 liters of Mountain Dew a day, and I really like to put Maker's Mark in it at the end of the night, and blah, blah, blah. You know, you start to hammer on the system. And when you hammer on the system over time, if you had a brand new car and every time you walk by it with a hammer, you just dinged it, eventually it's going to have a lot of dings. And now you got to work these things out. Plus, somebody probably get pissed at you if you dinged their brand new car.
Probably.
And so that's why you have to go through the process of bringing all this back in. And you can go on the internet and you can learn it. You can do what I did, which is 12 years of study. And I'm now enrolled in another course that's going to take 1.5 years. You can take that time and you can do that. Or you can go to somebody who's done this, like me, and have a shortcut.
You just basically have to feed the good guys to weed out the bad guys.
Yep. But you also have to know that, is the insulin in check? Is sugar in check? What's the foundational stuff you have to be able to feed the good guys now and bring them about? And then how can you accelerate that? Because that's what industry is doing now is they're looking at what types of fiber feed, what things, how can we bring in the polyphenols and the bioflavonoids? How do we do all of this to make Acromancia grow, to balance Bacteroides and Firmicutes, and to balance Firmicutes and
Too bad I just couldn't give you some of mine.
Yep, switch them out. She got plenty of Acromancia. I don't.
I don't even eat what he eats. I don't know how I feed it, but it likes it.
Well, you have different issues. Yeah, we just need to so a little bit of gross, but how do they actually, for somebody who's really bad, how do they balance this?
They receive the gut by getting skinny or fat poop.
Yep. You do a fecal transplant.
That's true.
And so they are actually trying to develop poo pills, freeze-dried poo pills.
We're having them.
Yeah.
We actually do it now. You either swallow them and they're freeze-dried, and you do them several times, but the gastric content usually kills that out. So
You're really eating crap.
No, so we actually do enemas. Yeah. We do them under endo and we do enemas.
Yep. And so that's...
And hope that they seed.
Well, they will seed.
They will,
but if you don't...
But your body will kill them off. The bad ones will kill the good ones off again. So you sometimes have to do it over and over again.
Once again, that's
fascinating. I'd like to have some skinny poo, please.
Well, that's why they say you have to have the garden prepped. That's why you do the underpinnings of, I hate to tell you this, people, but the standard American diet is actually an antecedent to all of this that's going on. Mm-hmm. And so if you eat the standard American diet, it is only a matter of time. It's not an if, it's just a matter of time before you're going to get gut dysbiosis. And we're seeing it younger and younger and younger because we're seeing the genetic reserve, as they call it, is dwindling by the generation. And so our kids was the first generation that had a shorter lifespan than their parents. And so, or is expected to have a shorter lifespan than their parents. And so that's the first time we've seen that. And when was I born? 1970. What came into existence in 1970? Ultra processed food. That is when we started to really get the push to have ultra processed food. And Calories are all that count. It's not the quality of the calorie, it's just the calorie. And we've taken all the fiber out. I've looked at enough food logs. I've had enough patients use a program called Chronometer. My average patient starts out getting about 8 grams of fiber a day. The average American is about 4 to 8 grams of fiber a day. And what's the first thing we try to do slowly? If you throw a bunch of fiber in on somebody, you might as well, the analogy is you're just throwing a plug in there because it's not going to move. But you slowly raise that up because that's what has to happen. And guess what? That doesn't come in Reese's cups and Twix and Twizzlers, all things that I had to say goodbye
Maybe
to.
we need to do that.
Yeah.
Maybe we should be adding fiber to Reese cups and we can make some money.
Well, you got to get rid of the high fructose corn syrup too. Just as an aside.
You need a side gig.
And there you go, side gig.
Hustle.
So just as an aside,
I got my new side hustle.
there you go. We have to look at Dr. Peter Attia interviewed a guy on cancer and a cancer cure. So, and this falls right into SIBO, because if you don't have good gut biosis, then you're not going to have the ability to make short chain fatty acids. You're not going to have the ability to make the neurotransmitters. Your immune system is not going to be modulated. And so they are trying stage 2 clinical trials for a ketogenic diet and a insulin checkpoint inhibitor. And so what they've done is they took 12 metabolically dissimilar, genetically dissimilar cancers. Then they said, first thing we got to do is grow cancer. How do we grow cancer? And so they did what I would have done was they threw sugar on it first. They threw glucose on it and a little bit, not much. So then they said, and you've all heard me before say that fructose is demon semen. It's just not good. Mm-hmm. And so they threw fructose on it, and I thought, this is going to go. And very little reaction. Same thing, almost identical reaction for what they said to the glucose. And I was like, that's a stunner. So then they started to look at the processes of how these things happen. They did mix them, and they threw it on there, and about the same type of result. But they said, what are the processes? Well, when do you eat fruit? When is fruit usually ripe? Fall. And what's happening in fall? We're all fattening up for winter because historically there's about to be a time of fasting, whether we like it or not. And so fructose goes into the body, and it doesn't turn off insulin. It turns off the check valve for insulin. So insulin, if it's flowing, just gets to free flow. But fructose does not stimulate insulin. So the next thing that they did was okay, well, if that happens, well, what happens when you throw glucose into the system? Well, glucose turns the hose on. So you lost the governor with fructose, and now you have glucose in here. Well, the body supplies the insulin. They threw that combination on the cancers, and they grew like wildfire. So you can actually call sodas. I'd probably get in trouble by calling sodas out by name, wouldn't I? So
it's just pop.
So pop, soda, brown fizzy, orange fizzy, green fizzy. Whoever thought of green fizzy? I love the stuff. Part of the reason why my bacteria are all jacked up. But whoever thought that was good looking? I mean, I remember used to look at the green stuff and be like, oh yeah, that had to be trained into me, because I look at it now and I'm like, oh, my gut just kind of goes, ooh.
They just had to pick a different color.
I guess so.
They had to sidestep to make sure they came to the top.
So all of these little different colored fizzy drinks have glucose, fructose, and your body provides the insulin. So it is literally cancer in a can or bottle, however you want to do it, out of a fountain. It's all the same. So, and I'm not the one that coined that term. I do like it though. So that was the side note. You want to grow cancer? Drink sodas. And once your gut gets off, here comes pancreatic cancer. Here comes whatever cancer you're genetically predisposed to. Because as we've said before, the genes load the gun, the environment pulls the trigger. And so I think I've covered a lot. How do we get the good bacteria? You start with fiber and you bring fiber in, but you've got to do the basis of cleaning up whatever it is first.
You eat it before you see it, or you just got a huge problem.
Yeah, you got to remove first, then you replace with good stuff, then you reinoculate. You're starting to look at the 5-hour program for functional medicine.
And most people can't do it with food.
Nope, you got to do it with. Well, that was a very interesting little tidbit I learned today. I like Dr. Mark Hyman. I like his Pegan shake and all of that stuff. I learned that when you are trying to,
You can't eat enough.
well, you got to heal the gut. And to heal the gut, if you're making the gut do the digestion, then it's overworking it. And so when you're using a Pegan shake, the Pegan shake should not be used to heal it. The Pegan shake should be used to maintain it. And I was like, oh. And this comes from a guy that knows Mark, and we were talking today. And so I was like, oh, okay, that makes sense.
Tell them what that means. So you shouldn't eat raw vegetables. They should be cooked, because your body shouldn't be taking the energy to digest them. They should be just using what they have available.
And you want to use like bitters, because even using hydrochloric acid does not, that's replacing the body's. Yeah. So if you use bitters start to bring in the body's own natural resources to do these things. We've got a few people online. I've been talking. Does anybody online have a question? And while we're waiting on that, you guys have a question.
Those folks out there that like their soda pop, you can make your own for probably 8 or 10 cents a serving. S. Pellegrino, some sort of drops, whatever flavor you like.
Blueberries, strawberries.
Well, I do.
Just get a fizzy drink with flavor.
Fizzy. So what I do in the morning, my habit is I take seltzer water. I have put in 2 liters of seltzer water. This comes from Undoctored. So if you look at the book Undoctored, I forget the name of the doctor that wrote it. 2 liters of seltzer water. I put 3 tablespoons of unflavored milk of magnesia in there. Make sure you pour a little bit off at the top, because it does do the volcano thing. So you take a little bit off the top, pour the 3. I will drink 8 ounces of that every morning, and I squeeze a lemon into it. And what that does for me is it starts to take my pH down, and it allows things to happen and flow and move easier. So, and I, did, even before I did my own test, that was something that I did, and I didn't realize how much I was actually helping myself. So I guess with that, we've been going now about 40 minutes. I'm going to once again say, if you have problems and you're in the Midwest and Indiana, you are more than welcome to get a hold of us. We do online consultations all the time. We can drop ship kits and things of that nature. We would love to help you. If you want to do that face-to-face thing, find a functional medicine practitioner. Go on to ifm.org, do the search, find one in your area, and I highly recommend going, because functional medicine is not about inhibiting things. It's about taking the 7 areas and balancing everything, and then allowing your body to do what it was designed to do. Thank you very much. And from Integrated Health of Indiana, this is Dr. Miller, Nurse Jessica. We will see you next time. End.
Very good.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.